Hey everyone, welcome back to my channel. I hope you guys are doing well. Today's video is going to be a little bit different. I'm going to review the most commonly asked questions that I receive from parents as a pediatric OT. This should be a really good review for looking over developmental milestones, especially the fine motor and gross motor ones. And also it gives you an idea of what parents are very interested in knowing about and things that you should sort of start to memorize and have a good idea about answering, because these questions come up a lot. I'm sure there are more questions and maybe I'll make a part two, but let's get started on the questions. When do kids know how to write their name? Kids typically know how to write their name between the age of 3 to 5. They might have it down as like rote memory if they've practiced it a lot with hand over hand support from their parents. But typically, kids know how to write most of the letters by age 4 or 5. So this is kind of a broader range, but that's the general ballpark. And I would assume longer names would be harder to learn. When do kids stop reversing letters? Kids stop reversing letters around the age 7. So if you see P and B and Q all getting mixed around and the child is 4 or 5, it's okay. When do kids start to jump? Kids learn to jump around 2 to 3 years of age. And I like to remember this because kids start to kind of tippy toe or try to go on their tiptoes a little bit after 2. So I feel like that's their preparation to jumping off the ground. When do kids learn to go up and down the stairs? This one is definitely a progression because kids can go up and down the stairs at a fairly young age, but they will need support from a handrail or a parent's hand. So by the time a child is 1 year and 6 months old, they can climb upstairs 1 foot at a time if they have their hand held. But by the time they're close to 2 years of age, children can walk up and down the stairs, at least 2 stairs, with both feet on each step. By the time they're 3.5, I like to look at like 3.5, 4-year-olds to see if they can climb up and down the stairs alternating feet independently. When can kids catch a ball? Kids can typically catch a ball around 3 years. When do kids learn to ride a bike? Tricycles with a wide base can be taught to a child at the age of 3, but typically kids don't have the coordination skills to ride a bicycle until they are around the age 7. Of course, some kids might learn faster. When do babies start eating solid food? Doctors typically recommend 6 months of breast or formula feeding, so after 6 months is when children are typically exposed to solid food. What is the teething period for babies? The first tooth usually comes out around 4 to 8 months, so the teething process lasts between 6 to 24 months. This is because the molars take time to grow out after your front teeth grow out, and molars start to grow out around 2 years of age. When do babies start to walk? Babies start to walk as early as 9 months, but typically between 9 to 12 months is when they start to walk. And by the time they're 14 or 15 months is when they become more comfortable walkers. When do kids show hand dominance? Children typically choose a dominant or preferred hand by the age of 5. So it's okay if you see a child who's 3 and they're switching hands back and forth during a tabletop or fine motor activity, but some children do decide that they have a preferred hand earlier than 5, and you can just stick with that hand if that's the hand they prefer and use everything for. So this concludes all of the most frequently asked questions I get from my parents working in both early intervention as well as outpatient peds. So I included all the questions, which is why some of them are geared towards babies and others are more for like toddlers. And I think both are very important to know, even if you may work with one population or the other, because they are all relevant in the full spectrum of developmental milestones. Something that commonly comes up is that when I talk to parents and I ask them if there are any milestones that their child missed, and I'll hear like, oh, he actually never crawled or creeped, he just skipped to walking. And that can pull up some red flags and help me understand where they are, if they have motor challenges or visual challenges, because if you crawl and creep, you have to learn how to maneuver your body, visually slow everything down. There's a lot of body awareness, visual motor awareness that you don't get to learn when you just start walking right away. And you may be able to see those differences in a child who skipped that milestone. So it's important to know what milestones happen at what point, and that way your treatment is more evidence-based, it is more developmental, and it can target some underlying issues that the child may have difficulties with that are carrying over into their later life. I hope this is helpful, and I will catch you guys next time. Take care and good luck.